Well, New York Governor Andrew Cuomo confirming 2 coronavirus cases in the state, one of which appears to be a, quote, community spread. Joining us now is Dr. Julie Vaishampayan, Public Health Committee Chairwoman at the Infectious Diseases Society of America. And Doctor, thank you so much for joining me today. Let me just get your thoughts just overall, the recent developments that we have gotten out of New York State, also the recent developments out on the West Coast. What is your read of the situation?
Well, as you know, there's been a lot of cases being diagnosed around the world. China is actually seeing quite a bit fewer cases, but there are many other countries seeing more, including the United States. And as we test more, I believe we will find more COVID-19 disease.
So Doctor, there's concern now just in terms of the community spread, especially the latest case here in New York State. How alarming is this?
Well, we expect to see more spread. We expect to see more cases. What it'll eventually look like, we're not sure, but we should expect to see more cases being diagnosed.
What's the likelihood that this will turn into a global pandemic?
Yeah, well, that's kind of the question. So we keep working at it. We're trying to use all our great public health measures to stop spread and mitigate the impact to the community and to everyone. So, boy, the likelihood, I don't have a crystal ball, but I think we need to plan and be prepared if it does.
Dr. Vaishampayan, there's a lot to talk just in terms of vaccines and the timing of those. We had President Trump meeting with a bunch of executives from the pharma industry yesterday. He was pressing just in terms of the timeline of these vaccines. We heard a number of those executives just caution that this is something that you don't necessarily want to rush because the repercussions there could be fairly serious. What do you think the timeline will be that we will see a vaccine that's, one, safe, and then two, that will be distributed in a timely manner?
Yeah, it's going to take a while because we have to ensure it's safe and that it is effective before it comes to market, and then we get up a big enough supply. So I do believe it's probably going to take at least 12 months to ensure that we have a safe and effective vaccine.
Do you think cities are equipped to handle a rapid rise in cases here in the U.S.?
I think they are. It's going to be difficult. I think we are equipped out in the community. That doesn't mean it's not going to be somewhat disruptive to our daily life. We will see effects if it continues to. We continue to see more cases, but we are more prepared than we've ever been.
Trump is saying that his administration and Congress is working on a coronavirus spending. From your perspective, what do you want to see the Trump administration do, or what should they do at this point?
Well, we need, to hurry the vaccine develop. That would be great. We also need assistance in managing hospital surge if we continue to see more cases in the public health response. Those would be some great places to invest.
All right, Dr. Vaishampayan, thanks so much for joining me today.
Thank you.